Hello and welcome to Pace Hospital's podcast. Today, we are focusing on an important men's health issue, that is prostate cancer, one of the most common cancers affecting men worldwide. Early awareness, timely diagnosis, and advanced treatment can make a life-changing difference. Joining us today is Dr. Abhik Debnath, consultant laparoscopic urologist, endourologist, andrologist, and kidney transplant surgeon at Pace Hospitals. With his vast expertise in urology and men's health, Dr. Abhik Debnath will guide us through the causes, risk factors, symptoms, diagnostic methods, and treatment approaches for prostate cancer. Stay tuned as we break the silence on prostate cancer, exploring how early detection and preventive care can protect men's health, right here on the Pace Hospitals podcast. Dr. Abhik Debnath, thank you for joining us at Pace Hospitals, Hitech City. Let's start by understanding what is prostate cancer.
Cancer is an uncoordinated or autonomous growth of cells in a tissue. So if it happens in the prostate gland in men, it is called prostate cancer.
So doctor, what are the types of prostate cancer?
The type of prostate cancer depends on from which cells the cancer originates. So in the prostate, we have a gland and a stroma. So if the cancer arises from the gland, it is usually called adenocarcinoma. This kind of cancer cells usually originate from the acinar part of the gland. The gland also consists something called as a duct. So if the ductal cells give rise to cancer, then it can be either an intraductal carcinoma, or it can be a ductal adenocarcinoma, or it can be either a neuroendocrine carcinoma or a urothelial carcinoma, which are very uncommon types. The most common type of prostate cancer is the acinar adenocarcinoma. Apart from this, if cancer arises from the stromal tissue, then it is called sarcoma. Even that is very uncommon.
Dr. Abhik, what are the stages of prostate cancer?
Prostate cancer staging is difficult to summarize, especially when considering the TNM staging, because it has 6 components. It has the clinical T stage, the N stage, the M stage, the pathological T stage, the Gleason score, or what is called the grade of prostate cancer on biopsy, and the initial PSA level. Based on all this, it is summarized and the stages are mentioned. But to understand it in a very simple way, we have something called risk groups. So the popular risk group system is the European Association of Urology EAU risk group, which classify prostate cancer into predominantly 4 groups. One is an advanced prostate cancer or the metastatic prostate cancer, and in localized prostate cancer, we have low, intermediate and high risk group. So the low risk groups includes those prostate cancer in which the Gleason group is grade 1 and the PSA is less than 10 and the clinical stage is clinical T1 or T2A. In intermediate group or intermediate risk group, the PSA is between 10 to 20, the clinical stage is T2B and the Gleason grade is grade group 2 or 3, that is Gleason score of 7. The high risk group consists of those patients where the PSA is more than 20, the clinical stage is T2C and the Gleason grade group is either 4 or 5. There is another group of patients which is called the locally advanced prostate cancer, which includes either clinical T3, T4 or N1 disease, irrespective of the PSA and Gleason grade group levels.
Can you explain what are the causes of prostate cancer?
Prostate cancer is predominantly a cancer of aging. So when men age, the incidence of prostate cancer rises in them. It is said that when men reach 80 to 90 years of age, more than 50% of them harbor prostate cancer in them. Apart from age, important thing is a family history or what is called the hereditary prostate cancer. There are certain genes whose mutations carry a risk of prostate cancer development, which includes BRCA genes, especially BRCA2, the check and the ATM genes. Apart from this, it is said that if in a family 2 or 3 members have prostate cancer, especially at a younger age, and if prostate cancer is present in 3 successive generations, then there is a high risk for development of prostate cancer.
So, doctor, what are the risk factors of prostate cancer?
As already discussed, prostate cancer is a predominantly disease of aging. So age is a very important risk factor. With advanced age, the chance of developing prostate cancer increases. Apart from that, as we mentioned, there is a component of family history involved in development of prostate cancer. There are some genes also which are responsible for its development. So point mutations in some of the known genes, especially the BRCA genes, leads to the development of prostate cancer. Apart from this, there are certain lifestyle and dietary issues which can lead to prostate cancer development, which includes metabolic syndrome. Metabolic syndrome means the presence of abdominal obesity, hypertension, and high blood sugars and blood cholesterol levels. So this is associated with the development of prostate cancer. Apart from this, high consumption of alcohol and smoking also leads to prostate cancer. Consumption of meat or oxidants of fried food in diet also leads to prostate cancer development. On the contrary, the consumption of antioxidants, especially lycopenes, like in case of tomato, or the consumption of vitamin D, helps to reduce prostate cancer incidence.
Could you explain what are the symptoms of prostate cancer?
Usually, prostate cancer does not cause important identifiable symptoms. Usually the symptoms pertain to that of benign prostatic enlargement or prostatism, in which patient develops difficulty in passing urine in the form of LUTS or lower urinary tract symptoms, which can be either storage symptoms, voiding symptoms, or post-micturition symptoms. Common symptoms include waking up multiple times in the night to pass urine, which is called nocturia, straining to pass urine, intermittency in the flow or poor flow of urine. Apart from that, there will be straining and post-void dribbling. Apart from these common symptoms, there are some symptoms which can suggest the development of a indolent or occult cancer in the prostate, which includes passage of blood in either urine or semen, and lower abdominal or lower back pain and weakness.
Dr. Abhik, what are the complications of prostate cancer?
Prostate cancer complications can be understood if we divide it in the form of its spectrum of occurrence. So prostate itself grows in size, and within that there can be a focus of cancer. So this may cause obstruction in the passage of urine, which can lead to 2 important complications. One is retention of urine. Another one is if the obstruction is very severe and if it obstructs the passage of or flow of urine from the kidneys to the bladder, then it can cause hydronephrosis and renal insufficiency as well. But if prostate cancer doesn't grow and obstruct the urinary passage much, instead it spreads to other organ systems, then it can cause complications pertaining to its spread. So this commonly leads to bone pain and pathological fractures and back pain. Apart from that, symptoms can arise when the disease spreads to other parts of the body, depending on to which part it is spreading to.
So doctor, how to diagnose prostate cancer?
Prostate cancer can be diagnosed either by incidental detection, especially when screening is done in the form of PSA testing, or it can be diagnosed when there are symptoms, especially non-specific vague urinary symptoms, and when a urologist examines the prostate clinically by his finger put inside the rectum of the patient and they feel a very hard nodular prostate gland. When there is a suspicion, we can do a PSA testing. Usually the PSA is a marker of the prostate gland itself, so it's not disease specific, it is organ specific. But in case of cancer, usually the PSA levels tend to be on the higher side. Apart from this, we need a biopsy to confirm our diagnosis. So prostate biopsy can be either taken by transperineal route or by a transrectal route through a small needle under local anesthesia. For staging of the disease, we need either an abdominopelvic CT scan, MRI scan, bone scan or a PSMA PET CT scan.
Can you explain what are the treatments of prostate cancer?
Prostate cancer treatment can be divided based on the stage of prostate cancer. Usually for low grade disease, especially if the disease is a low risk one, then if the life expectancy is less than 10 years, then the ideal treatment is watchful waiting. If life expectancy is good, then active surveillance can also be offered to these patients, which is the usual first line treatment for a low risk disease. Local treatment in the form of surgery, that is radical prostatectomy, or radiotherapy, that is the radical radiotherapy, can also be done. For advanced prostate cancer, usually the treatment is systemic treatment in which hormone injections are initially given, followed by other adjuvant treatments in the form of chemotherapy or medications.
Could you explain how to prevent prostate cancer?
Prostate cancer can be prevented by adopting healthy lifestyle practices, especially to prevent metabolic syndrome, that is, to prevent weight gain and abdominal obesity and hypertension. This is the most important thing. Apart from this, to adopt healthy food habits, which includes a balanced diet and adequate hydration, to avoid consumption of fried foods and oxidant containing food products, especially meat. There are some literature suggesting that the use of medications, that is chemo prevention with the help of finasteride, can help to reduce the prostate cancer incidence. But the meta-analysis of these studies, however, say that the benefit is very low. In fact, the reduction of low-grade prostate cancer occurrence is there with the help of the use of finasteride or dutasteride. But there is a relatively higher occurrence of high-grade prostate cancer, and there is no change in prostate cancer mortality rates. So as such, as of now, there is no established role of chemo prevention or prevention of prostate cancer with the help of either dietary supplements or by medications.
Dr. Abhik, at what age does prostate cancer occur?
There is no particular age cutoff for prostate cancer occurrence. Obviously, as we know that it is a disease of aging, so we expect the disease to occur more frequently in patients who are older than 60 years. We say that from autopsy studies, it is said that after 40 to 45 years, the incidence of prostate cancer slowly begins to rise. It is maximum, especially in the 80s and 90-year age group, where the occurrence rate is about 60, more than 50%.
Can metastatic prostate cancer be cured?
There is an old saying that usually people die with prostate cancer than from prostate cancer. That means prostate cancer among the other cancers is a good cancer to have with because it's not a very lethal disease unless it is a very high grade disease or has a altered differentiation. Usually prostate cancer is a low risk disease, and even if it spreads to the other organs, the survival is relatively good, and medications are available to control the further spread of prostate cancer.
Is prostate cancer hereditary?
Yes, as discussed, prostate cancer is hereditary, especially when it occurs in less than 60-year age group. It can be inherited in the form of either from parent, either from the father, or it can be in the form of point gene mutations, especially in the known genes such as the BRCA gene, the ATM gene, or the CHEK gene. These gene mutations can lead to prostate cancer in up to about 10 to 15% of the patients. Overall, true hereditary prostate cancer occurs in about 2% of the patients.
So, doctor, how dangerous is prostate cancer?
Prostate cancer is not a very lethal disease. Usually it is a low to intermediate risk disease in most cases, in which it is very indolent in its course and it can be cured. However, in certain cases, especially when the PSA levels are very high or if the Gleason score is high, especially Gleason grade group 4 or 5 patients, or in them in which there is altered differentiation like neuroendocrine differentiation, in them we say that the prostate cancer is biologically very aggressive.
Could you explain prognosis of prostate cancer?
Prostate cancer prognosis depends on its grade and stage of the disease. Based on the grade and stage, there are many societies which have designed risk groups. The most popular one is the European Association of Urology EAU risk group classification, which I have already mentioned, which includes either an advanced disease or a localized disease. In localized disease, the disease is classified into low, intermediate and high risk disease. Usually the low or intermediate risk disease, their prognosis is very good, whereas even in the high risk disease, if early treatment is instituted, then the risk or the prognosis is good. And for advanced prostate cancer as well, the treatments are available in the form of chemotherapy and hormone therapy and other androgen antagonist therapies, which offer good survival and prognosis to the patients.
Dr. Abhik, can you explain life expectancy of prostate cancer?
The life expectancy of prostate cancer depends on which stage of disease it is and which grade of the disease it is. Usually for localized prostate cancer, the survival is excellent. There are long-term active surveillance cohorts, as well as there are some randomized controlled trials which show that the survival over a period of 10 years is said to be about 90%, especially in low-grade or low-risk prostate cancer. Coming to advanced prostate cancer, so hormone-naive metastatic prostate cancer also has about 5 to 6 year survival.
So doctor, what is the difference between benign prostatic hyperplasia and prostate cancer?
Benign prostatic enlargement and prostate cancer both usually present with the similar symptoms. It's just that in prostate cancer, there is usually a recent worsening of the lower urinary tract symptoms, and there can be symptoms such as blood passage in the urine or semen. Apart from this, there will be systemic symptoms, low back pain or bone pain or pathological fractures. Pathologically, if we see, then the two diseases are entirely different. In benign prostatic enlargement, there are no features of cancer within the cells when examined under a microscope. Whereas in prostate cancer, all the features suggestive of cancer are present in the cells when seen under a microscope, and they are grouped categorically with the help of a system which is called the Gleason grade group.
Dr. Abhik, what is the difference between prostate-specific antigen level in benign prostatic hyperplasia and prostate cancer?
There is no PSA cutoff for benign or for prostate cancer. Usually it is said that the PSA is organ specific, it is not disease specific. So PSA can be high in case of other diseases of the prostate, which includes either an infection or any inflammation of the prostate. But we should understand that there is another term called PSA density, which is quite popular, and it is said that for every 100 gram of prostate, up to PSA 15 level is considered as normal, which is called the PSA density of 0.15 nanogram per cc. That means that for a 100 gram of prostate, even 15 cc or 15 nanogram per ml of PSA will be considered as normal or will be considered to be in the benign range. But in case of small prostate or medium sized prostates, we say that usually PSA should be below level of 4. 4 to 10 PSA level is considered to be a gray zone PSA level, and definitely more than 10 PSA level is suggestive or tends to direct or point towards an occult malignancy in the prostate. Also, we should remember that with lower PSA, we are not immune to prostate cancer. Even with a PSA of 2 or 3, there can be prostate cancer.
Can you explain, does masturbation cause prostate cancer?
There has been a study which clearly has shown that with higher ejaculation frequency, there is a decrease in the occurrence of prostate cancer. So this study has compared the ejaculation frequency of more than 21 times a month as compared to 4 or 7 times a month, and it has shown that the prostate cancer occurrence can decrease to up to 20% in case of them who ejaculate more frequently. So actually, more sexual activity or masturbation is associated with lower risk of prostate cancer occurrence.
So, doctor, can anabolic steroids cause prostate cancer?
Prostate cancer has been linked to testosterone. That's why in advanced prostate cancer, the primary treatment of choice is androgen deprivation therapy, in which we give medication to block the testosterone. But that does not mean that if we give testosterone to a patient, that will lead to prostate cancer occurrence. It has been seen that in those men who are hypogonadal, and in them we give anabolic steroids or testosterone supplementation, in them there is no increased risk of prostate cancer occurrence.
Does Viagra cause prostate cancer?
No. Viagra means sildenafil. It comes under a group of medication which is called phosphodiesterase inhibitors. They have no associated risk with prostate cancer development.
Dr. Abhik Debnath, one final question. Can prostate cancer be treated without surgery?
Prostate cancer can be treated without surgery, especially localized prostate cancer. Now, radiation therapy is an alternative to surgery. And we have to understand that those patients who have a large prostate or who have bothersome lower urinary tract symptoms with higher residual volumes and a poor flow, for them radiation treatment is not an appropriate choice. So your urologist will be the concerned person or the specialist to help you to guide treatment towards prostate cancer and to choose the appropriate therapy. Apart from this, for advanced prostate cancer, the primary treatment is systemic treatment with the form of hormonal treatment and other medicines including chemotherapy.
Thank you, Dr. Abhik, for sharing crucial information regarding the prostate cancer to our listeners. I hope this information helps our listeners. Understanding prostate cancer, its causes, symptoms, risk factors, and treatment options is essential for maintaining good prostate and overall men's health. If you or someone you know is experiencing symptoms such as frequent urination, difficulty in starting or stopping urination, or discomfort in the pelvic area, don't ignore these signs. Early screening and timely medical care can make a life-saving difference. We'll be back soon with another episode on Pace Hospital's podcast. Until next time, stay informed, stay proactive, and take good care of your health. Thank you for listening.